Hello everyone, welcome to BDS tutorials for dental students. Today we are going to study about Marfan syndrome. Now the Marfan syndrome also has names such as Marfan-Eckardt syndrome or arachnodactyly. Both of this can be asked in exam. Coming to the cause of Marfan syndrome, it is mainly because of defect in chromosome 15, that is, the mutation of FBN1 gene in chromosome 15 causes defect in the connective tissue elasticity, thus causing Marfan syndrome. So it is an autosomal dominant disease where the fibrillin 1 has defect in structure and function. So the flexibility of the connective tissue will be hampered due to defect in cysteine in the fibrillin structure. Now, the clinical features can be broadly divided under three headings such as mm, musculoskeletal system, cardiovascular system, and ocular system. Under musculoskeletal system, the cardinal feature is arachnodactyly, where your fingers are thin, slender, and long. There is the normally when thumb is placed under the little finger and made a fist, the thumb do not exceed the little finger. But in Marfan's patient, the thumb exceeds the border of the little finger, thus giving arachnodactyly. Other than that, there is something called as dolichostelomania. As seen in the picture, the dolichostelomania is a feature where the trunk is smaller than that of your limbs. So your limbs are extremely longer than that of your trunk, thus giving a improportionate body appearance. Also, there can be kyphosis, scoliosis, or flat foot. Also, there is going to be dislocation of joint very often. That is, habitual dislocation of the joint is seen. The face is going to be very narrow, and the skull is going to be very narrow and long in the patients with Marfan syndrome. Aortic, coming to cardiovascular features, aortic dilation is very often. Other than that, aortic regurgitation, aneurysm, mitral valve prolapse, all this can be found in Marfan's patient. Coming to ocular symptoms, ocular features, patient might have myopia or cataract. Very oftenly seen is dislocation of lung lens as shown in the picture. Retinal detachment and retinal tear is also very often in Marfan syndrome patients. Coming to the oral manifestation of Marfan syndrome, a patient will have high palatal arch, a patient will have bifidulum and multiple odontogenic cysts. These are the very important features in Marfan's patient. High palatal arch, bifidulum and multiple odontogenic cyst. Along with that, there is also malocclusion or temporomandibular dysarthrosis in the patient. Radiographically, the high palatal arch sometimes can be appreciated in radiograph, or the enlargement of frontal sinus or enlargement of skull height can be identified. Coming to prognosis, prognosis is fairly good when compared to ages before 50 years because of the developed technology. So And about the treatment, there is no specific treatment for Marfan syndrome. However, symptomatic treatments such as mitral replacement of mitral valve for mitral valve prolapse, or aortic replacement for the aortic aneurysm, all such treatments can be given to the patient. Fact to remember is US President Abraham Lincoln also was told that he had Marfan syndrome. So, this is a fact that you can remember. And here we end our class. Thank you so much. Hello, everyone. Welcome.